All right, I'm Jabari Mitchell, and this is my head-to-chest return demonstration for Health Assessment 1.
I'm Victoria Offsprung, and I consent to Chamberlain using this video for educational purposes.
Okay, let's take a quick look around the room. Okay, so the first thing that we're going to do when we walk into a patient's room is we're going to want to wash our hands. Okay, hi, my name is Jabari. I'll be your nurse today. I'm just going to do a quick head-to-chest assessment on you. It'll probably take about 20 minutes max. Is that going to be okay with you?
Yeah, sounds good.
All right, awesome. So first of all, could I get your name and your date of birth?
It's Victoria Offsprung, 11/3/1994.
Okay, great. Okay, and Victoria, do you have any allergies that I should know about?
Not that I know of.
Okay, and how's your pain today? On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever had, what would you rate it today?
0, no pain.
Okay, great. All right, do you know where we are right now?
We're in our apartment.
Do you know what year it is?
2020.
Okay, and do you know why we're here?
Let's do this head-to-chest demonstration.
Okay, so it looks like our patient is alert and oriented ×4. Looking at her physical appearance, it doesn't look like she's in any acute distress right now. She is dressed appropriately for the situation. She looks like she's nourished, like she's had a shower. Her behavior, she seems happy. Her facial expression, look, she's smiling. She looks to be in a good mood, and her speech is clear. She didn't come in walking with a cane or any assistive devices that we should know about, so she's got a smooth, even gait. We're just taking notice of all of those things as we're walking into the room. Okay, so next I'm going to take some vital signs here. All right, let's take the pulse. Okay, her pulse is 92 beats per minute, and while I was doing that, I was also checking her respirations. Her respirations were at 18 breaths per minute. Her temperature, we checked that earlier. It was 98.6 on the dot, and her oxygen saturation was at 98%. Also, her blood pressure was at 120/80, a perfect blood pressure. Okay, so now I'm going to do some assessments on your skin, just checking to see if there's any abnormal colorings here, any cyanosis or pallor. We're going to check for any lesions, any incisions, any wounds that we might see, or any masses or tumors that we might be able to see. We see some tattoos here. We want to make notes of those. But besides that, the skin looks intact. It looks moist. It looks a good color. Okay, next we're going to go to the nails. Her nails are not clubbed. I don't see any clubbing here. We're going to assess her capillary refill on the thumb here. Okay, it came back within 3 seconds, so a good capillary refill. Okay, now let's move on to your head. Okay, I see no lesions or infestations in the hair or the scalp on the head. Okay, when I'm looking at her face, if you look straight at me, I look at her face, it is perfectly symmetrical, so no drooping on either side. That's great. Okay, and then let's just palpate your neck here real quick. Okay, I don't feel any masses on the neck, and I don't feel any masses near the trachea. So, no, I don't see any hardened lymph. I don't feel any hardened lymph nodes in there, or I don't. It feels normal. Okay, so next we're going to move on to the eyes. Just my little pen light. Okay, let me check these eyes. All right. Okay. Pupils are equal sized. They're equal, round, and reactive to light. If we hold it over one eye and check, she's got accommodation, meaning that when I shine the light in one eye, both eyes constrict. So that's where we want it to be. I'm also let me check here. Let me look at your conjunctiva. Conjunctiva is nice and pink, appropriate for her race. And her sclera are white. No redness. I don't see any discharge coming from her eyes. Yeah, so her eyes look good. Good color. Yeah. Okay. So next is gonna be her ears. All right, let me check in her ear here. Okay. So I'm not seeing any drainage, no redness, inflammation, no swelling of the ear canal. From what I can see of that external meatus. So that is good. Then we're gonna go to your nose. Could you tilt your head back just a little bit? Okay, let's see. Okay. Looks like your nose is symmetrical. I see no deviated septum. I don't see any drainage from her nose. I don't see any swelling, no inflammation in the nose or redness. Yeah, okay. And then could you possibly hold one nostril for me and breathe in? And then do it on the other side for me? Okay, so she's got bilateral nasal patency. So, excellent. All right. Okay, next is going to be your mouth. Okay, so open wide for me, would you? Thank you, ma'am. Thank you very much. Okay. And I don't see so her lips, her gums, and her lips are pink and moist. Her tongue is pink and moist, also good color, and her gums are also a good pink and moist. They're all good color and moisture. Okay, and teeth are also white. So okay, so no sign of infection there. All right, so the next thing that I'm gonna look at here is going to be lung sounds. So I'm gonna use my stethoscope. I'm gonna use the diaphragm of the stethoscope to listen to the lungs. And just to note, in a clinical setting, we would have to take the shirt off. It has to be the stethoscope has to be straight to the skin, pressed against the skin. But for our purposes, we're not going to do that. So let's see. Each time I place it, could you breathe deep for me?
Yeah.
Okay, thank you. Okay, here's the right upper lobe, left upper lobe, right middle lobe, left lower lobe, right lower lobe. Okay, and we're going in that Z pattern so we can hear bilaterally each sound and make sure nothing's different. Now we're going to go to the posterior, right upper lobe, left upper lobe, right middle lobe, left lower lobe, and right lower lobe. Okay, great. So I didn't hear any crackles, rails, rhonchi. I didn't hear any sounds. When I was watching her breathe, I didn't see her using any accessory muscles to breathe. So that is good. And also, she doesn't have barrel chest. Her chest is equal. It's the right ratio from anterior to posterior. Okay. So next thing we're going to do here is I'm going to listen to your carotid artery. Okay. Or not listen, I'm going to palpate for the carotid artery here. Okay, felt that. Okay, carotid artery is very strong. Excellent. Never want to do both sides at the same time. That cuts off blood flow to the brain. Next, I'm going to do our radial arteries here. Okay, so I'm going to listen to both of these at the same time, just so I can get a sense that, so I can see if there's any differences from right to left. Okay. Okay, so the carotid and the radial look good. So we're going to check here for jugular vein distension. Just from looking at her straight on, I can't see any jugular vein distension. So that is great. I would lay her back at a 45-degree angle and check once more for jugular vein distension. But we don't have a bed here. Okay, next I'm going to listen with the stethoscope to some heart sounds. Okay, and for these purposes, just to make it quicker, I'm only going to use the diaphragm, but we want to listen with the diaphragm first, and then we want to listen to the bell also for any abnormal sounds. Okay, so let's see. So right side, second intercostal space, and we're going to listen to the aortic valve here, right next to the sternum. Okay. Next, we're going to listen to our pulmonic valve, which is going to be our second intercostal space, right next to the sternum. All right, hear that pulmonic valve. Excellent. Great. And then we're moving down to the Erb's point, which will be third intercostal space, and right next to the sternum. Okay, sounds good. Okay, and then we're going to move to the mitral space, which would be our fifth intercostal space, midline with the clavicle. So we're going to go and we're going to find that mitral valve in that fifth intercostal space. Okay, I can hear that. Excellent. Okay, next would be the tricuspid, and that's going to be fifth intercostal space right next to the sternum. Okay, very good heart sounds. All right. So I didn't hear any murmurs, or I didn't hear any swishing back and forth that you'd normally hear with a murmur, going back, blood going regurgitating through those valves. Yeah. So yeah. Okay. All the pulses seem good. Okay. Excellent. So, ma'am, that concludes my my assessment. Well, one last question I'm going to ask you is, could I rate your pain right now on that same scale from 0 to 10? What would you say that your pain is now?
Still a 0.
Okay, great. Well, is there anything else I can do for you today?
No, I think that's all.
All right, awesome. Well, you have a great day, and if we were in the hospital setting, I would lock the bed if I need to. I'd take it all the way down to the lowest level. I put the guardrails up, and I give them their nurses, or the call button. I'd give them their call button. The last thing that I'm gonna do before I leave the room is gonna be to wash my hands before I leave. And that's everything. Thank you.